our support group at least once a year to talk to folks about what to do with that excess skin when Spanx no longer work. So he has been with Shawnee Mission for many, many years, and he has worked on a lot of patients who have had weight loss and had revisions of that skin. And he's going to talk to you about everything that they can do, what they can't do. And so, Dr. Cusick, I'm going to let you take over.
Wow, what a great group. My word. I thought when Dr. Hohen started and Dr. Hamilton started this bariatric program, it was a small little program, but over the years their reputation has grown and grown, and it's really fun to be part of that growth that they've been able to experience, and then of course to share with you. I had the opportunity. Well, first let me introduce myself. I'm Doug Cusick. I was born and raised in Kansas City, and went to Shawnee Mission South High School. Then traveled, and I was away for 15 years to get all my degrees in education. So to become a board-certified plastic surgeon, it takes 15 years of higher education. And then my wife and I decided to settle back in the Kansas City area. But ironically, Dr. Hohen and Dr. Argon, who's the new doctor here, they're trained at Loma Linda University Medical Center, which is an extension of the Adventist Health System, which is what Shawnee Mission is, and that's where I trained as well. And so we actually have the same basic training. We've trained under the same doctors. This is out in Southern California, but we've left beautiful Southern California, Kansas City. And so anyway, cool weather's coming tomorrow.
That's right. That's right.
Anyway, so, but the growth of this program has been wonderful, and I had the opportunity to work with multiple surgeons who do bariatric work throughout the city, and I get referred their patients who had weight loss, and I must admit with no hesitancy whatsoever that the patients who come out of this program not only have the best success, less chance of complications, or if they do occur, they're really minimal. And the patients also are really, the techniques they've developed here, patients are really been good about retaining their weight loss as well. And I've been watching this over the years, and this is compared to some of the other bariatric-based programs as well. Because as you know, there's a lot of different various techniques, and Dr. Hamilton, Hohen, and Argon are really good about tailoring each technique for you. And so, real quick show of hands, who all's already had their bariatric procedure done? And then, is anybody yet to have it performed? Is there? So there's a few of you still on the front end of all that. And so we're going to scare some of you first because there's wonderful benefits in losing weight. Wonderful benefits. Your health is better. Your energy levels are better. You feel better about yourself. You're excited about going out. Family members are so happy that you're going through this process and really are excited about sharing it with you. The unfortunate side is that there is, as you lose weight and as that weight has been on your skin and pushing against your skin over the years, you tend to lose some of the elasticity, like a rubber band of our skin. And so what happens is as you've lost weight, and those of you who have been on that process of losing some weight, that elasticity isn't there, and so you have excess tissue. It's not only skin, it's excess. Some fatty tissue is going to remain in the abdominal area, sometimes underneath your arms, between your legs, and in the breast area. And so when that fatty tissue forms and sits in that area, no matter how much weight loss that you have, it will remain. So don't be discouraged, because that happens to everybody, what you'll experience. And so, it isn't, and once you get down to appropriate size and weight that the staff here are happy with and that you're happy with, don't be discouraged that you have some excess tissue, because that can be addressed, and that's what our as plastic surgeons that we're able to achieve for you. Plastic people, who knows what plastic surgery means? Do you know does anybody have any idea what that means? People always ask, that's one of the most common questions I ask, plastic surgery, what does that mean? Do do you use plastic? And so what plastic originates from is the Greek term, it's from the Greeks, and it means plastikos, which means to mold and to shape. And that's why we hear the word plastic. Plastics were invented in the 40s and the 50s, and that was a product that, you know, in a liquid form, it could be molded and shaped. Well, as plastic surgeons, we do that to your bodies. And so when you come in and you have a part of your body which isn't shaped correctly or isn't in the position that you want it, that's what we're able to do, is to reshape and to reconfigure that component of your body for you and to bring you back. That's what plastic surgery is. And so the plastic surgery entails a lot of things. I do hand reconstruction after major traumas. Just today I had a guy run a table saw through 5 of his fingers. I got an organ or a microscope and fix all those things. That's on the emergency side. And so, but my regular practice might be, you know, taking care of work such as people who've had weight loss. Also, people who just for cosmetic reasons don't like the way that they look. They may have had melanomas or major cancers, and I rotate big muscle flaps and big reconstructive flaps that way. So, you know, some of the work we do is cosmetic based, and some of the work that we do is on the reconstruction side, usually after cancers or major traumas, to just restore functionality back to people's lives. So that's what I'm able to achieve in my work. Each of you, as you lose weight, will have components of your body that you're not happy with. And I've got a couple books here that I'm going to send down through the aisles. I don't show a big picture frame because a lot of these patients are without clothes or naked, and I just think it's more appropriate. They've given a permission for you as individuals to see their photos. These are actually my actual patients, and as opposed to showing them in a paper rather than a big lecture forum. So I've done it in individual books, and they're comfortable with that. The books are different, so I'm going to send them down and then cross over the back and send them back up, so you can each see the book. So what they represent are people, and you'll see very carefully the before and the after. And all these patients have had significant weight loss changes in their life, anywhere from 35 to 150 pounds, is what you'll see with these patients. And it'll start with some faces, and then you'll see some breasts, and then you'll see some abdominal areas. You'll also see some arms in terms of what I'm able to achieve in the work that I do. These procedures, for the most part, they're done in an outpatient setting, with the exception of some of the major leg work and some of the abdominoplasty work. Many patients are able to go home right after the procedure, which is nice and very, very beneficial to be able to do. So before I get going on any further, because I have some, is there any specific questions that people might have?
I've been calling around to different surgeons, and it was an idea from another person that had gastric sleeve. That's what I had, because we lost a lot of weight. I mean, like when I had my surgery, I was 374, and now I'm 153.
Good job.
And yeah, but you wouldn't want to see me in the shower. But the thing is, there were a lot of surgeons who didn't have experience removing that much skin, and there were certain things that I didn't know, you know, that become really loose. And I thought there was a problem, and there wasn't.
Right.
You know, for women.
Right.
Yeah, I didn't know about that. It scared me. I freaked out my, OBGYN. But I mean, do you have experience dealing with? Because some of them don't. They don't know. I mean, and she found a surgeon in Denver, but he wanted $24,000 to do.
Sure. She's just talking about the experience, and she's exactly right. And that's why I'm here today and have been for years. Is that the procedures that we do are extensions of oftentimes the cosmetic work we've always been doing. Abdominoplasties, eye lifts, neck lifts, face lifts. These are procedures that you hear about all the time. And in a weight loss patient, there are some needs that Carla was bringing up that she noticed when she interviewed doctors that they weren't too experienced at doing. And so we've actually have a whole branch now of doctors who have taken an interest. And there's about, and I'm not the only guy in Kansas City doing this. There's about 4 other doctors who do a lot of the weight loss patients as well. And I would make sure you choose a board-certified plastic surgeon who has a lot of experience, has photographs, and we have a lot more in my office, which we have patients who want their pictures only private for one person. And we can show you a lot more examples of the work that we have done. And so anyway, so that's, yes, it's very important that when you interview your doctor, that you make sure that he is comfortable doing it. And it has taken extra training to do this. It's really, though, it is an extension of some of the other work, but you have to recognize, because you've lost the elasticity to your skin, we can't rely on some of the old traditional techniques that we've used in the past before. So anyway, right back here.
And since we're cosmetically trying to improve those problem areas, what is the scarring that you would incur from something like that? Because these are areas we want to now show off.
Exactly.
But if we're going to have scarring in these areas, what's the new?
Well, one of the good news about the positive part about losing your elasticity of your skin is that tension causes bad scars. So if I took care of an injury to a child who's growing and their skin is growing, and then if I took care of somebody who's middle-aged, such as myself, and took care of an elderly person, that elderly person will have a scar that you'll hardly see because they've lost elasticity. The middle-aged person, a modest scar, a child, it's horrific. Same location, same issue. So as you have lost that elasticity to your skin, you've lost tension to it as well, and so as a result, the scars are usually wonderful. Now, they don't look great. All scars don't look great in the first few weeks, months, but after 6 months to a year, they just really soften up and look really nice. That is one advantage of having lost your elasticity. Yes, Stephen?
I'm guessing that for those of us who are insurance denied as and we were private pay, this would still fall under something that was part of bariatric, so it probably wouldn't be covered, right?
Yeah, for the most part, these procedures do not, as a whole, aren't covered under health insurance, and so we worked out nice fees to be able to help people with these procedures, and so they do fall under the cosmetic realm. So, yes.
So, if you had this done, I'm on Medicare and Blue Cross, so I thought I heard, I don't remember where, that if there's a problem with the skin in an area where it's chafed or rubbing because of it, that sometimes that can be covered because of the problem?
Yeah, in general, no. If it is a big, it would just require removing that chafed area. That's not going to achieve what you want to do. So yeah, we can, if somebody's actually has a chronic infection in an area, but that's not going to get you a whole abdominoplasty. But if you had a little bit, and so it means requiring. So yeah, there has to be insurance covering for medical necessity issues. So anyway.
Yeah.
Okay, say you have to have your arms and your legs and your breasts and your abdomen all done. They're all different surgeries, so none of them can be combined or
Oh, I combine some of the procedures, and that is done on an individual basis. So we try to keep our length of our surgeries under about 4 hours, and so that's what we try to do. So certain procedures, depending on what needs to be done, we can do. And if I can try to keep my surgeries under about 4 hours, and that stemmed from some of the issues with complications arising from procedure. You just saw what happened to Joan Rivers 3 days ago. Yeah. She had a little throat procedure. They would take, I think, a little nodule off her vocal cord in the office. Very routine procedure, and you can see what had happened. Yeah. And when we evaluate, and you hear of other horror stories occasionally with plastic surgery. I've never had anybody hospitalized. That's one thing we never expected to. We never had a death personally, but it's because of several characteristics. And when our society investigated, particularly 15, 20 years ago when we had some problems, they were occurring mainly in Florida and California. We had one instance with a guy here in Kansas City. With all of these instances were occurring in a setting either of where the doctor had operated for too long a period of time, had too much fluid shifts, or he was doing it in an environment where the monitoring wasn't corrected. And so and both of those, my entire career, I've always been cognizant of the length of time of surgery, which includes some blood loss, and also I've always done it in an outpatient facility such as this facility here. And so where you have I'm a board certified plastic surgeon, you're under the care of a board certified anesthesiologist. The nurses, as you know here, are superb, many of them with higher degrees, master's degrees, and so that's the environment where you have these procedures done. And in some certain situations, I do have you stay overnight, and you have private duty nurses taking care of you overnight, and so for safety related issues. So when you do any kind of procedure, if it was your bariatric procedure or the procedure that I perform for you, safety is really important. We don't want to have a complication. We don't want to have any kind of problem associated with it. So your safety is utmost for me. And so the society comes back and says, okay, try to keep these surgeries under about 4 hours or so. Don't do multiple surgeries, but there's certain things that aren't very stressful to the body. Maybe I can do a neck lift and do arms at the same time, or I can do, if you don't have too much abdominal, I can do some abdominal work and some breast work at the same time too. We would try to keep it in that kind of realm. But yeah, it does. And the other advantage of doing them in smaller aliquots like that, you recover right away. And so when you try to do multiple procedures in one setting, you're down for weeks and weeks and weeks at a time. Whereas some of the procedures I do, we try to get people active right away in a week or two.
So as a follow-up, can you get a ballpark figure on what each one of those costs?
Yeah, it's really kind of variable. You're looking at, you know, the abdominoplasty work might be anywhere from $8,000 to $10,000. The work around the face or neck lift might be anywhere from $8,000 or so. And that's including facility fee, anesthesia fee, physician's fee, sometimes an overnight stay type of fee as well. So some of the work on the arms or brachioplasty is probably the arms. Usually can be even less than that.
Is that for both arms?
Yeah, we do them at the same time. We do one of the, all, you know.
Alternate?
Yeah, put you on the installment plan or something like that. Okay, Maggie, I'll get you now and then I'll get you later.
Is there ever, I have excess skin in places I never dreamed of.
Yeah.
But it's so bad that I am experiencing some autoimmune supplies and I'm diabetic. And so I have to be very careful about that. Is there ever are there ever cases where I still have 60 to lose before we get to go? Are there ever times when somebody can get like the...
Well, I'd have to see you. I'd have to evaluate you. On certain occasions. It doesn't, for instance, take care of all this abdominal, but we can take care of the wounds themselves. Yes, you have to be careful. We have to be careful in medicine. Fraud is a huge issue for doctors. There's a strict Medicare guideline book is this big. We have to be very careful about what is medically necessary and what is not. And so I'm very, very careful on that. I sit on many credentialing committees, and so I see people who do fraudulent activities, and they are prosecuted. The doctors are prosecuted, and it's oftentimes he was pushed by patients to do things that really weren't medically necessary. And Medicare fraud is one of these horrible issues involved with. So, or any other insurance fraud. Medicare really goes after doctors, big time. So, anyway, so we do have to be very cautious. And so, yes, can help you.
When would be the best time for us to go and see you?
Oh, perfect.
Do we wait until we're done with the weight loss, or do we, like, I've lost so much weight and I just want an idea, so I have some idea how much money to spend?
Okay. Coming to see me, it's a $40 consultation fee. It's really inexpensive. And when you have surgery, it's charging you surgery. So essentially, it's free to come to see me for a consultation. My preference in operating on somebody is when you're about 10% of your goal weight overweight. I want you to touch overweight. So you don't even have to be at your perfect weight. If you are, that's fine. But where I like you is if you're about within 10%. So let's say your goal weight's 150 pounds and you're at 165. That's an appropriate time to be doing the procedure. And then some people come in even a little earlier when you're 175 or so, if you're heading to 150. And so that's just kind of a range. The reason why I touch overweight is I want your body, your body's, as you're losing weight, you're in what's called a catabolic state. And a catabolic state means you're in that process of losing weight, and there is some shrinkage going on inside of your skin, whether or not you feel like it or not. And so after the surgery, I want a little bit more of that shrinkage to still occur. And so I prefer you kind of on that slight downward path. Nutritional health is really important. Are they working with nutritional health with you guys here? Yeah. Okay. I just can't emphasize, and I'm sure everybody has, how important nutrition is in this whole process. And so if the whole world, if we were all in good nutritional health, we really wouldn't. A lot of us wouldn't be in a weight situation to begin with. So this process of you losing weight also has to be combined with nutrition. I can't emphasize how important nutritional health, and I'm sure that's talked to you about all the time, but maintaining that is really important. And that's true. If you're going to invest in your own body for this. Be the nutritionist. Yeah, okay. I didn't even know. And so, there we go now. So I'm plugging for you. There you go. No, it's really important. I went, 20 years ago when I was in my training, we talked a little bit about nutrition back then, and I kind of went, and I cannot emphasize over the last 15 years how it's true. People who are in poor nutritional health, their wounds don't heal. I have complications, and so when people are in appropriate nutrition in their bodies, we don't have any problems. They just heal up so nicely. And then you also are able to maintain the results that I have stay, which is nice. You want to do this, and keep in mind, you're doing this. I'm changing your life for your body shape, the way that you look, for the rest of your life. The next 30, 40 years of life that you have ahead of you. So what we're able to do it's really wonderful. But nutrition really is a very key important part of this. And so yes, you.
I apologize. I have two quick ones.
Sure.
One is, how do we know what our goal weight should be? Because I don't have one. And number two, what about external nutrition? Meaning, are there things that we should be doing? I mean, I'm on a bunch of forums and people talk about cocoa butter, vitamin E, but I also, from some other things, believe that the skin is an organ too. Are there things that we could be doing to contribute to helping with the elasticity and the shrinkage of this skin?
Excellent questions. In terms of the last, you're exactly right. Mainly, I can't emphasize how damaging the sun and radiation is to our body and to our skin. So prevention of sun, using sunscreens. You need to use a 30 SPF or greater with sunscreens. Anything greater really doesn't help you out. The SPF 30 gets you 97% block. You have to go all the way up to 60 to get up to 98% block. So going anything over a 30 isn't really that much more beneficial. And then vitamin E is felt by many people to be very beneficial. Keeping your skin moisturized, keeping it moist, and not going to extremes of dry to humidity is helpful as well. And so that's in terms of health of skin. So vitamin E lotions with vitamin E are felt to be helpful as well. And so what was your first question?
Goal weight.
Yeah, goal weight. Yeah, I'm not. It's you're just going to have. What happens is what I see patients, and they'll talk to me when they come in. They've been on an extreme, and now they're starting to plateau a little bit. That's probably, and if you've maintained good nutrition, as you start seeing this plateau, that might be where you're going to be 15%, 10-15% above your weight. And so that's when you start seeing extreme weight loss start to plateau. That's a good time to come see me. Does that kind of make sense? I'll see you at any stage. Yeah, once you start recognizing issues that you have, and when you come to my office, I'd like you to prioritize what you want to have done, because as you mentioned, there's multiple things you want to have done. A lot of women, I'm shocked at how many women like to want to have their arms done first. The brachioplasty, I'd say 50% of women like to start with brachioplasty. You know what? That's a great place to start. It's economic, it's not highly expensive. You heal up, it's really predictable results. You'll be thrilled with it. So that's a great place to start.
Because there's no way to hide it.
Yeah, exactly right. Okay, back here. Okay, for the first year after surgery, your oil glands will shut down in your skin. And so there is inherent dryness of your skin in the area that we've worked on. So we emphasize I have a vitamin E with a steroid mixture that I have you put around the incisions in any area of dryness. It's a prescription strength that works wonders and gives beautiful scars. It really works nice. The rest of your skin, products with vitamin E. Right now I'm recommending the Nivea products with extra dry skin with some vitamin E in it, and they're really working really nicely, keeping people's skin real moisturized, applied twice a day. So about a year you'll notice dryness that needs to be augmented with just some simple over-the-counter lotions. And then we get you started on the incisions themselves to help soften up the incisions and get them to heal up really well. So,
what about coconut oil? I use that, and it's virgin or whatever they call it. It's supposed to be 100% free or what. But someone else told me also is, what about those body wraps? That can really is it true that they really do help with the skin before you?
The body wraps give you temporary improvement, and so in terms of help reducing size and also moisture, and then some are putting moisture into the skin.
Right.
Some of the wraps help reduce your size. What it's doing is pushing the fluids out of your skin and the edema, and so you get a temporary improvement. Women will do it oftentimes. They're trying to get me pretty dressed or go out on a weekend, evening, or date or something, or a formal affair, because within a week or two you'll notice after that wrap the condition will. But they can push moisture in if you want.
Yeah, that's what I was looking for.
Yeah, it can be done. It seems like a pretty expensive way to do that, but anyway, I'm going to go right here in front and then.
Breast implants had such a stigma several years ago, and what are some concerns you should be concerned with breast implants? I mean, I've been in a really bad car accident, and the steering wheel was totally infringed, and I had my seatbelt on, but the force was unbelievable because the car was crunched. So
would it harm you if you had implants at that time?
Yes, and that concerns me. And then how in the world do they do mammograms with those in? I have to figure that out. I get there, she says, "Do you have implants?" And I'm like, "No, but I'm not sure how you put those around to do that."
The implants now, for those of you, just a quick history on breast implants. Not every woman who lost weight, a lot of the women are happy with me just lifting their breast up into position. You will have a hollowed out look right here if you don't put implants in. Implants will give you a fuller look, a perkier shape to your breast. So sometimes we will add implants on with the improvement of your breast shape and size, because the tissue that's sitting down here kind of hanging, I don't like using it. It does, once I put it up here, it falls back over time, and so I remove that lower pull tissue. An implant does work better, but there's a few people who are adverse to using one, and so we put it up. Last year, 450,000 women in the United States have breast implants placed. In Johnson County, 1 out of every 8, I know Johnson County does this for my practice, 1 out of every 8 women have implants. And you don't even know it because they just look nice and shapely. And so implants went through an interesting history in the 60s, 70s, and 80s. They were invented in the 62 by Cronin down in Houston, Texas. And he used a silicone implant and got Dow Corning to supply the silicone. In the 25 years up to early 1990, there was no regulation of the industry. Dow Corning would give anybody silicone, gave it to anybody. It was just it was an industrial strength gel. And then these companies put these different wrappers around it. And some of them were good, and many of them were horrible. And so there were about 25 manufacturers when I was in my training. And we put them in, and over time, many of them deteriorated. And so the women now had gel floating around in their bodies. 1992, FDA says, we're going to study these. For years, they said they didn't want to study them. 92, they did study them. They pulled them off the market. They were off the market for 15 years. I was part of an IRB, and I was part of the few doctors around who could use the earlier ones for studies. And in total, we put about 40,000 implants in over the next 15 years, and they were a study implant. With the new and improved implant, we've studied these women. And so I was part of that process. But for the most part, we all went to saline implants for the next 15 years, from 92 to 2007. By 2007, we had implants in 40,000 women, had studied many of them up to 10 years with the newer style implant. And what they did is they used a shell, the FDA says, use a shell that we know works. For instance, they were being used around pacemakers and different, so there were shell around this gel, and then they also had the companies strengthen the gel. So the gel now, you can cut the gel, it goes nowhere, it doesn't migrate into the breast. And then also the shell, you can literally drive a car over these shells. They're extremely stable. So the FDA's criteria for an appropriate breast implant was to meet the safety that we had with saline, because saline is just salt water running in your veins. When you all had your surgery, the salt water running in your veins, we just take another bag of that off the shelf and put it in a known stable shell that doesn't, it's inert, and we put that in. So a saline implant is totally safe, 100%. I mean, we don't have any complications, but it's firm, it's a little harder. Silicone does do a better job. It looks better, it feels better, it's more realistic. And so that was the criteria. The FDA said, it's gotta be as safe as saline. And by gosh, they did it. And so now we've got from 2007 to the present day, that's what, 7 years now. And we have close to 3 million silicone gel implants in around the country. Plus the implants, FDA never went through this process, or the implants never went through this process in Europe. And so Europe changed as needed. And so Europe's got many more millions of women than us. And so we've studied those women, and they are now safe. And mammograms are done, there's no problem. They're very durable. I've got women, race car drivers, scuba drivers, parachute jumpers. There's nothing. On rare occasions, you'll see one might rupture a little bit. You see it with an MRI, a little rupture of the implant. They're guaranteed. The implant, the gel doesn't go anywhere, so it doesn't harm the breast. And so we do a procedure, we take it out, put a new one set back in. The implants are guaranteed for life. So each part's not labor, you have to pay it. At least we have to pay for the implants again. So that's the history. And mammograms are, in fact, believe it or not, a mammogram is easier for a radiologist to read. And that was the first issue in 1992 when the FDA pulled them off the market. Do they cause cancer? You know, there were some women say it's caused my cancer. But what we found was that the radiologists, when they see an implant behind there, they actually were taking more views and more cautious, and lo and behold, they actually were catching cancers earlier in women because they were doing this to their screen instead of looking at their 100th mammogram. You know what I mean? And so they found that the radiologists were a little more conscious. But in today's environment, what we find is that the implants push the breast tissue away from the chest wall, and it's easier to read. That's why. Because you have breast tissue against your chest wall and rib cage. You can't see through the ribs. And so that's where cancers get missed. They don't get missed out by the nipple or anything like that. They get missed deep. And so by now your breast tissue is protruding out. It's no longer against your chest. We catch it. So, yeah.
You had mentioned earlier about how the skin in your thighs takes longer, or it's longer to heal. Is that because your legs rub together when you walk?
It's just that in terms of success on these procedures, in terms of what I hear back and feedback from all my patients, brachioplasty women are thrilled with. It's a 2-hour procedure. It's not highly expensive to do, little limited pain. The next is abdominoplasty, repairing the abdomen and taking off that big abdominal pannus. And I come in, and I even like, believe it or not, even though you lost a lot of weight, I liposuction, shape, and contour, and get you hip and waist back, as you can see from some of those pictures in there, and get that shape back. That's very, very successful. Neck and facelifts are very successful as well. Those are very successful. Breasts are modestly to well accepted. You can't get a breast perfectly perky again, but at least you can get it up to where it was. And so most women are pretty happy as long as I show them plenty of pictures befores and afters, so they know here's what it's going to look like. And every person's breasts are different, and so it's really unpredictable about the behavior of the breast. Anything that protrudes from our body is really hard to predict. The other is thigh lift, and it's not this area here. It's you come in and you don't like your knees a lot, and so we don't have a procedure to fix that knees, but I've got a great procedure to fix that excess tissue there. So as long as your expectations are okay there, that's taken. But you're right, it's a little harder to heal. It is hard to walk. You're uncomfortable for 3-4 weeks, you know. I can imagine. A little uncomfortable, so, yeah. Yeah.
I'm here representing my husband who had cancer, and he has man boobs. What do you do for that?
I use a combination of liposuction and reduction of breast tissue. The first thing I'll do is I'll look at his the elasticity of his skin. Some people, if they're younger, I can just do liposuction only, and they're quite happy, and we can get that skin to shrink back. If there's excess tissue, I'll remove a little bit of tissue around the breast. If the nipples have fallen, I actually have to lift the nipples, which is similar to a reduction or a breast lift procedure that I do for a woman. And so, yeah, so that's I'll use a combination of both liposuction with reduction of the breast tissue. So.
How do you take
Can I use you as an example?
Sure.
Okay, come on up. Roll your sleeve up as high as you can.
He's got a knife in his pocket.
Yeah. Okay. All right. Okay. Okay. Now turn this way. Okay. All right. Well, we're not ready to see. Okay. Now put your arm out. Put your arm out. Good. Just bend your arm for a second. Okay. So here's her elbow. It's called the medial epicondyle. You're a great candidate. The final incision. You may have some of you might notice some excess skin down in the axilla. So the final incision when I'm finished will reside right there, a little tiny white scar. It kind of tucks up underneath it here. And so my first process I liposuction. I actually use liposuction because there's some fat. I want to kind of thin and shape and contour this part of the arm down. And then I'll remove, see this piece of tissue here? I will remove a piece of tissue larger than what you see right here, larger than that, and then bring the tissue from the back side and reattach it up here to the front side. And so that's what and so you have a little scar, and we wear ace wraps for about 3 weeks afterwards. And so that's all, and you can be pretty active within a few days. So it's a little tiny incision. After 6 months to a year, you can hardly see it. And so some people, my preference is to stop at that. Now that's why you bend your elbow, is a medial condo. Some people with weight loss have to extend it. That's one of the extensions of it. Yeah.
This is going to sound silly, but when you have the abdominoplasty, do you get to pick any belly button, or do you stop?
Well, first off, I use your same belly button. I do use your same belly button, but I can I'm really creative for it. Well, anybody who's got an outie, unless you want it, I'm going to turn it into an innie. So I can make those changes for you. So, yeah.
What are your experiences with tattoos? Doing tattoos?
Yeah.
Working around?
Oh, yeah. So, right, if they fall in an area. Right, so it's really creative. Like the other day, I was doing a breast lift on a woman, and she had a creative tattoo. I literally, and she was okay with it. Her nipples needed to be like 10 centimeters from here. And so she said, look, I said, either I'm going to go in your tattoo. If I go in like this, I'll take it off all the way. Or if I go out just a little bit, we'll save it. And she says, let's save it. So I made her, instead of 10 centimeters, I made her 11. And she won't notice any difference in the tattoo. So it depends. And so I work around it. So if it's, a lot of women have a tattoo maybe right here. And I see this a lot. I'll work around that. And some women say, take it off. And so I'll take care of it for you. So sometimes if you're running right through it, sorry?
I said sometimes it works out where you can take them off.
Oh yeah. If it's in the right position, I'll tell you the minute your consultation. Or sometimes if you do have to run through it, they'll go, once they heal, they go back to a tattoo artist and alter it a little bit. So it can be, so if you have those issues, so. Anyway, all right, anybody else, right here.
Abdominal skin removal was painful to me. What is the pain level and the recovery time and the restrictions during that recovery?
Got it. The abdominal pain, what makes an abdominoplasty more uncomfortable is the tightening of the muscles, and that's more commonly needed in women than in men. And the reason, because many women have had, particularly if you had babies, what happens when you have babies, your rectus muscle, all of our rectus muscles when we're young are vertical, they're sitting like this. They have a slit down the middle called the linea alba, and when God built you and you get pregnant, you're designed to come apart. You literally are, to accommodate the baby. Now, the muscles they're not herniated or anything, but this stretches. And over time, a couple babies, they don't go back, as you notice, and a lot of women's abdomens are somewhat protuberant. It's not always from fat. So when I go in and do that, and I will discuss that with you at the time of your procedure, because this has a lot to do with pain. If you want, it only takes me a half hour to do it, but boy, I can tighten those muscles and really get a nice tight tummy, but you're uncomfortable for about twice as long as if I just took off skin and removed the skin. So removing the skin isn't that uncomfortable. If I just remove the skin and the fat and did some liposuction, within about a week you're able to drive. You'll have a few drains. Women often drive to my practice at day 9 and I pull out the drains. But if I tighten your abdominal wall muscles, you're having somebody bring you to my practice at day 10, pull those, or 9 and 10, pull those drains out. And by 2 weeks you're feeling okay. But if you go back to work after about 2-3 hours, like, I'm exhausted, you know, that type of feeling after about 2 weeks. And then about 3 weeks you're able to work pretty much full time. And if you're traveling on your job, and I'll ask you all these questions, what's your job entail? What responsibilities do you have at home with children? Who can help out at home? And I'll help you through that. And then you can decide whether or not you want me to tighten your abdominal wall muscles. Some women say, don't bother the abdominal wall muscles, I want to get recovered as quick as possible. That's fine, we'll get a nice result too. And so, okay, I'm going to ask people right in the back. Somebody right back there.
I have, I'm looking, I'm not forward to it, but I'm going to have knee surgery, a replacement one. So I guess my question is, would I need to have that done before you did, like the thigh and the hips and all that? Or would it be done afterwards?
It really makes,
should it be done?
Yeah, it doesn't make any difference to me. We would space, you need to be spaced out. So if you're going to do your knee before, I want you completely through your rehab, because you'll have some downtime to recover from my procedures. And so your rehab becomes very important with your knee. If you choose to go with me prior, you would do my procedure and you wouldn't do your knee for at least 6 weeks, be my thought, is how I would recommend that on the timing side. So,
My job is pretty physical.
yeah.
How much time would I have to take off and the stomach done and
Okay.
breast?
Yeah, breasts are not that uncomfortable. It just depends on the wounds need to heal for breasts. So they were talking about 2 to 3 weeks for that. How much weightlifting are you doing? And
I can lift 40, 50 pounds.
in your job?
Yeah.
And then, so the first question I say, is there any way you can modify your job? Can you go to your supervisor and say, hey, can I come back at 2 weeks at a modified work duty for a couple of weeks? So if they can't accommodate that.
I have to actually be able to climb one of those industrial ladders on the south side of the building.
Yeah.
I have to be able to do that.
Yeah, we're talking about 4 to 6 weeks there.
Okay.
Yeah, so I always like people if they can get to a position where they can modify there.
And I know you commented on, just baby weight. But what happens if you have the wonderful cesarean pooch that is just part of the way you were, kind of sewn back together? Are you able to correct that as well?
Yeah, oh yeah, I'd say half the women come to me, they've had C-sections. And so you're referring to the scar that you've got there, and the pooch that comes out. That's all part of it. And then a lot of weight loss patients not only have the abdominal, but you have the pubic region. It's all part of the whole. It's all part of the deal. Yeah, I take care of that. Yeah, it's one and the same to me. And so I just bring it all together and all that type of thing. So yeah.
You were talking earlier too about abdominal surgery and that muscle thing. Well, I've had obviously the sleeve surgery, but I've also had 2 hernia operations as well. So, having said that, I got all these scars all over my stomach. Does that make it harder?
No, I can work around them. I have no trouble working around them. Sometimes I do find where little abdominal hernias pooched out, I fix that. So my background, I have the same education as Dr. Holland, Dr. Hamilton. I'm a general surgeon as well. So I have additional training on top of there. So I'm a general surgeon. So if I run into something like some docs, I fix it.
Because I have a third. That's what I was asking too. That was my next question.
Yeah.
So
I take care of it. It's just part of what I do. Yeah, it's just part of what I fix. Okay, we got a new one back here. There we go.
Can you talk about the complete lower body lift a little bit? I'm specifically wondering about cost, surgery time, and recovery time.
Yeah, it's hard when you use the word complete lower body. That's a difficult term. What we're talking about, or you're referring to your legs and thighs.
I was just reading in the brochure. I've heard of it before as the 360.
Yeah, so a lot of times you can't do totally circumferential on the legs. Sometimes we do that nearly with the abdominal area, where circumferential means incisions all the way around. On the thighs, there's a high level of potential dehiscence because you need to walk and be active. Dehiscence means breakdown of the wound, so we don't want to have that happen. So I do an extension, and again, I really need to see you and evaluate you. But we either come up and around here, I go low, or sometimes I come up and incorporate it up into an abdominoplasty and then come down up around the buttock area and lift the buttock and lift the thighs at the same time. And so, you know, again, I just need to, it's hard because a lot of the costs have to do with the time, how much time, recovery room, so it's, costs are really, I don't get involved too much with the cost. My office manager, Sherry, she's scheduled over, I think, 10 years. She's scheduled 12,000 surgeries for me over the years, and she works up all those costs and takes care of all that. So when you walk away from a consultation, you're gonna, here's what the process is for me to visit with you and how we take this the next step further. Because today is just information. You make a scheduled appointment. We do this on Tuesday afternoons, sometimes Thursday afternoons when I visit patients for these consultations. We'll schedule out in a half hour, you'll schedule out 20 minutes to a half hour with me. And I'll spend that time with you. You'll be at the office for about an hour because you have forms to fill out and you'll see me. And then you'll spend 15, 20 minutes with Sherry. And I'll take photographs. We'll talk exactly what needs to be done. What I ask of you is to prioritize what you want to have done. And we'll get you a cost because of the 2 top priority items. We'll get you costs right there, right then. If you're still away from your goal weight, which is fine, it's kind of where I'll price you out where you are now. And if you change, lose a little more weight, it might be a little less costly, less time to do. So it's really time based. The facility, the anesthesiologist, they all have the time. And then when you leave the office, you'll know to the penny what that costs. Okay?
I'm far away from my goal weight, but it would be okay to go ahead and come now just to give an idea.
Sure.
Get an idea.
Yeah. Please do. And so, yeah.
From the time that somebody comes to visit you and the time that you would be performing the surgery, I mean, it probably depends on how.
Yeah, we're 3 to 4 weeks out from doing a procedure. In terms of my scheduling?
Yes.
Yeah, 3 to 4 weeks. Yeah, a long procedure is kind of tough to do. So I leave spaces in my schedule, but those are for people who've had injuries and stuff like that, the reconstructive side that I like doing. So, but an elective procedure is 3 to 4 weeks. Christmas is impossible. I mean, we're getting almost booked up for Christmas. In fact, to the point, I won't do a big 3-4 hour surgery right before Christmas. Kids get off from school, and I do a lot of pediatric plastic surgery and stuff like that as well. So anyway, so I take care of a lot of children. That always happens at Christmas. And we just went through that rush before school right now. And so we're gonna right back here and I get to you, Margie.
I have a lap band. Would you recommend emptying it before surgery or just removing some fluid? What would you do first?
I'm sorry, so you're gonna recommend doing what with it?
I have a lap band.
Yeah.
And say I was going in for surgery with you. Would you recommend emptying it or does it not have an effect?
Yeah, I don't think it has any effect or anything, so I think it'd be fine. So you all stay, without anything to eat or drink for anywhere from 8 to 10 hours. We're very cautious. If there's a concern about any fluid collecting in the stomach or in those regions, we pass an NG tube, a tube which pulls any fluids, things out. Go ahead, Andy.
What was it? Oh, I was going to ask you as we kind of move in the direction of towards, eventually when we're going to get the surgery, does exercise play kind of a role as far as elasticity and stuff?
It really does. Exercise, part of the nutrition that I spoke of, any kind of exercise, even if it's out taking just a walk, every other night, take up, half mile, start with a quarter mile, half a mile, and then you work your way up to a mile. So any kind of exercise is very, very beneficial to the quality of your skin, elasticity, and it also helps you metabolize your nutrition and helps you then also have the correct attitude about the way you eat and the way that you feel. So there's a lot of benefits to the exercise on top of that. We're getting pretty close to need to be done. Chris is back there. Yeah, what you got?
Did you say there wasn't anything any kind of surgery to take care of knees?
Yeah, knees are really trouble. Yeah, because when I do the medial thigh lift or any of the lateral or medial thigh lifts, They look good for the first month or two, and they deteriorate. It'll improve at 20%, 30%, but don't do the procedure just for your knees. Does that make sense?
No, I wouldn't.
Yeah, I can
I would
improve
use
them a
it
little
definitely
bit,
for
and
water.
I'll show you my office when I see you. Every person's different, and so, but you can't go in thinking, this is my primary reason for doing it, is to improve my knees. You just don't have, and a lot of doctors have told patients they'll do that, and that they were misrepresenting themselves. We just don't have. Chris?
You see advertised on television, the
Oh,
lifestyle.
yeah, okay, got it.
Yeah, what
Let
is
me-
that?
Okay, the lifestyle lift is simply a facelift done under local anesthesia. And what it is, it's a huge national company. It was put together by several board-certified plastic surgeons. In fact, a lot of us were asked to join the lifestyle lift group here in Kansas City. Their niche is doing it in their office under a local anesthesia. And so as a result, a lot of compromises are made. The only guy who signed up was a guy who got tired. He's about an early 60s guy. He was down at Children's Medical Center doing all children's stuff, and he got tired of being up all night in the night, so he signed on with them, and he's doing it now. And they're under local anesthesia, and it's just a basic facelift that I do. We put you under sedation anesthesia. You're much more comfortable because you're not having awareness of what's going on, which is nice to have. Otherwise, you're wide awake, and the surgeon, they give you some drugs to sedate you, but there's nothing different than what I do either. And it's expensive because you're paying for all that national advertising that they're doing as well. I don't advertise. I just come to meetings like this and talk to people and, that type of thing. So I don't have all the overhead that those guys have. And feel free to go visit with them. So that's fine. But there's a lot of compromises that are made as well. You for the most part, a weight loss patient needs pretty extensive work around their neck to lift that out and to improve the face. And they only just do some basic work in that. And sometimes they have nice results, but it's but essentially it's a facelift that I do. But I do have you under sedation anesthesia for comfort, and that's really the difference. So that you're paying. So age with the procedures, health is what I'm interested in. That's what the anesthesiologist is interested in. So they operate on an 85-year-old woman, removed a huge melanoma and reconstructed a bigger part of her body, and she just flew right through that procedure. She's healthy, so we don't even look at it. We don't hardly even think of age. What we're looking at is your diabetes, and as you noticed, as you've lost weight, you've gotten healthier. Your diabetes is improving. Many of you have been able to go off your medications. Your hypertension is improving. Your health is improving. You then also focus on nutrition. That's better. That's what we look at, and that's what the anesthesiologist will look at. Before you're going to do the surgery, you're going to visit with the anesthesiologist. And so if you're very healthy and we're not doing a major surgery, you just see him the day before. And on occasion, once every other year, I'll have an anesthesiologist say, hey, I don't think we need to get that patient tuned up a little bit. A lot of times I can recognize in the office, get you to your primary care, we call it tuned up, get your hypertension under control. Or we have you visit the anesthesiologist a week or so before, and he talks with you and makes sure you're healthy. So don't worry about age. Not at all. It's your health. And as you're losing weight, you're becoming healthier. And so we don't usually have these problems.
This question came up from one of my coworkers, and I thought I had right answer. Difference between these kind of surgeries and body contouring.
Right.
Body contouring is really just to help lose fat, correct?
Yeah, body contour. Well, I'm contouring and shaping your body. I mean, I think this is all.
I used to see the ads for the body contouring. You say, "Why don't you do that?" And I'm like,
I'm shaping and contouring your body. I mean, though, where the difference is, people think that some of the plastic surgery procedures we're doing are taking off weight. And really, we like to use the word body contouring, but even though I'm going to remove that abdominal pannus might weigh 7 or 8 pounds, plus some of the liposuction, so I'm taking off 8, 9 pounds of tissue from you, even though you've lost a lot of weight. I'm taking off. We don't want you to be considering it as this is not to help you. This isn't to lose weight. This is to shape and to contour. So I like using the body, and I am doing. I'm shaping and contouring your body to look more natural. more natural shape. So it is body contouring, even though I'm taking off tissue, you will lose weight, but don't think of it as losing weight. So, yeah.
Okay, I have a question, maybe an obvious question. So, if a woman has never had children,
Yeah.
should she wait till that possibility before having this?
Well, if tummy, I've had about 3 pages. You're talking about abdomen, anything else, arms
Anything
and
else is fine,
legs
but
and face and breasts,
And eyes?
anything, yeah, all that. Yeah, the children really affect the abdominal wall. I've had 3 patients in my practice who had their tummy tucks thinking that they were finished with babies, because it's probably the most reasonable thing to do. And then they've had babies later, 3 of them, and all 3 of them did just fine. They did great. Because they lost their weight right away. The key with babies is getting rid of your weight right away. Yeah, they did okay. And then only one gal I did a little revision because she had something else done, and but she hardly needed it. So you can go ahead and have babies. Most women, before they do tummy work, they do tend to have their babies first, because the babies do some damage. You had a question?
Yeah, as I've lost weight, my doctor discovered I have lymphoma.
Uh-huh.
And how does that, is that part of, would that be removed? Lymphoma?
Oh, no, it's called a lipoma.
Oh,
Yeah,
okay.
lipoma.
Yes.
The lipoma. Sometimes I combine it with the procedure. That I can get covered by insurance, believe it or not. So sometimes we do it at the same time.
So it's just a fatty?
Yeah, a lipoma is a fatty tumor. They don't have to come off. If they're bothering you or hurting you.
Yeah, but never showed up until I lost the weight.
Yeah, it was probably there.
And then, but they're not,
Yeah, it'll probably remain. A lipoma is kind of an animal of its own. It's what a lipoma is, and you guys might notice. You might notice lumps and bumps on your skin as you've lost weight. A lipoma is normal fat behaving kind of in an abnormal fashion, not cancer at all. But it has its own little encasement, and these fat cells start growing inside of here, and they start growing. I got one on my arm right here, a little tiny one about the size of my thumb. It's right here on my arm. It's been stable for 30 years. And so as you lose weight, most likely a lipoma won't change much, and so they'll pop. They'll all of a sudden you're seeing them. They're probably have always been there. Yeah, and so as you've lost weight. Okay, one more question. Now we got her tied up. Yeah.
Is it okay if I had a stroke 6 years ago?
I need clearance.
Mhm.
I would get clearance from your primary care, and then of course get clearance from the anesthesiologist.
Right.
Yep.
Okay.
So we'll get that. We'll get all that clarified before we. Remember, safety is number one. We're not going to have a complication with you guys.
Yeah.
All right.
Well, I had 3 surgeries.
It may happen, but it's going to be minor.
Right.
All right. Anyway, hey, I want to congratulate you guys on such wonderful success. And good luck in the future. We're available for you. Just contact us, and we'll get an appointment. Usually it's in the evening. And Tuesdays we work really late, so you can do if you work all work and stuff. Tuesday evenings I see patients really late. Other times they're all in the afternoon on the appointment. So I'd love to see you all. Just there's cards and brochures in the back, and just kind of get that, and just kind of give you some general idea. And I'd be more than happy to just be to help continue the success that you've had. And I really felt like God put me on this earth to really help people out. And I'm just so proud of you guys for doing this. So that's wonderful. So thank you very much.